A new nodule on the skin should always be treated as cancer until proven otherwise. This 57-year-old woman came with a 6-month history of an increasingly irritating, scaly nodule on her left upper arm. Look at the dermoscopy. What do you see? What is it? And how confident are you of your diagnosis? When I first started using a dermoscope 10 years ago, lesions like this scared me into referring to make sure it wasn't cancer. So let's slow down, gather the evidence and make a verdict. Note the sharply demarcated edge. There's yellow-white keratin scale across the surface in parts. But what about these darker dotted areas? At first glance, you might confuse them with aggregated globules of melanin, suggesting a nevus. But look closely. Most of the dark dots are associated with the scale. They're irregular in shape and they're not the neat round globules we expect in melanocytic lesions. I think they are thrombosed vessels. We see dot and hairpin vessels within a milky background, and in places the blood appears dark red. UV light gives us a different perspective, and if you squint slightly, the surface pattern looks almost like the folds of a brain, a classic cerebriform pattern. By now, some of you will be shouting, "This is a seborrheic keratosis," and you'll be right. All these features point in that direction and nowhere else. This means reassurance. This is not a cancer, and it will never turn into one. Treatment only needed if it's symptomatic or cosmetically bothersome. But are you 100% sure? Are you willing to bet your patient's life and your career on it? This doesn't look like seborrheic keratosis. It shows a lacuna pattern consistent with a small capillary hemangioma. It appears to be colliding with this slightly irritated seborrheic keratosis. I make no apologies for showing you lots of sub-Ks. Over 50% of the skin lesions I see are sub-Ks. Patients are often worried that this is cancer. If you can crack their code and confidently diagnose these nodules, you'll use that skill again and again, and you'll save your patients a huge amount of worry.